Okay, Dr. Glenn Caley, welcome to the podcast.
Thanks very much. Good to
Um,
be here.
yeah, I've been really looking forward to this conversation. I've actually been wanting to get a few more, if I use the term, bodywork practitioners onto the show. There's been a lot around gut health. There's been a lot around sort of immune health and hormones. But I feel I'm being drawn back to my roots, which is in the personal training fitness industry. So having an opportunity to pick your brain from a sort of chiropractic perspective is going to be exciting.
Perfect.
So for people who aren't sort of familiar with you or your work, are you happy just to share a little bit of your backstory and your journey?
Sure. As to why I became a chiropractor, or?
Yeah, just sort of, I guess, anything that sort of helped you make that decision and what you've been up to since being a chiropractor, really.
Sure. I'm kind of one of those strange or very fortunate people, I suppose. I've known what I wanted to do from about 13 or 14 years old, and that's never wavered at all. When I was very young, after sports, I'd always go home crying that my knees were really sore. And I remember going with my mom to the hospital, and I saw all the consultants and blood tests, and no one could really figure out what was wrong. My mom was seeing a chiropractor at the time, so she took me there. I clearly remember him adjusting me, and that went away. The pain went away, but I mean, that doesn't even register as a child that young.
Right.
I think the real thing for me is the longer I stayed under chiropractic care, the bigger changes kind of happened. My asthma went away and my allergies went away. And that drove me towards finding out the philosophy of chiropractic and the fact that the body doesn't actually need anything to be healthy. It just needs no interference, and it needs to be able to work the way that it should. And once that penny dropped, there was nothing else that I wanted to do. That's what I wanted to be able to do for people and with people every day of my life. And that's driven me through high school and into my studies.
Amazing. Yeah, I guess it's a similar story to mine, where I was having kind of chronic injuries. Ultimately, I sort of tore my hamstring a few times. I had compartment syndrome in both sort of calves that led to a couple of operations. And that's really what propelled me into just a fascination with the human body, I guess, really. So I think I'm right in saying, from having a little look on your website, that you declined a scholarship from a rugby perspective to go and start training in chiropractic. Is that right?
Yeah, in the States. So in my last year in high school, I was offered a scholarship to go to the States to play rugby.
Okay.
But I was happy in South Africa, and I was playing decent rugby at the time. So I started my studies in South Africa, but I didn't quite find what drove me towards being a chiropractor. My studies were great, but something was missing. And into my fourth year of chiropractic school, I was a member of the World Congress for Chiropractic Students. So there's a congress around the world in a different country every year. And just getting to spend time with students from other countries and who had studied abroad kind of really took me back to, this is what I want to do, and this is what chiropractic is to me. And I was fortunate at that time to be offered another scholarship to go over to California and finish my studies at Life West. And so within about 2 months, I was student loans, living in the States, and starting a whole new journey, and completely changed my perspective and definitely my trajectory in my work and what I do.
So maybe it's a good time to sort of dive into the difference, because correct me if I'm wrong, but is there sort of traditional chiropractor treatment and then sort of a slightly different way of assessing and treating a client from a Gonstead perspective?
Chiropractic is chiropractic.
Okay.
Started in 1895, and chiropractic is based on your body having its own innate inborn intelligence that's constantly controlling and conducting all your body's functions and its ability to heal. And that intelligence is conducted through your body via your nervous system. So if your brain cell and your tissue cell have good communication, your body's going to be able to function and coordinate as best that it can. If there's something impeding that function, we're not going to work the way that we should. That's kind of chiropractic in a nutshell. Obviously, like any profession since then, different branches have come off and everything's got its own purpose. some people have gone very, very much musculoskeletal with that. Some people have, and then there's a lot of different techniques as well. From a Gonstead perspective, Dr. Gonstead, he passed away before I was even born, and he grew a very big practice that had its own landing strip, its own motel, because patients and doctors from around the world came to see him, but also to learn from him. And I got very interested in the Gonstead work in my first 2 years of chiropractic school, and mainly because it just answered the questions for me. So my biggest thing was, if we had these subluxations, which is nerve interference in the spine, if we had these and they're as detrimental to our health as we truly believe, then we probably aren't walking around with 6 or 7 of them in our spines all the time. So for me, it was, well, how do we know what the major ones are, and how do we very accurately find those and then correct them? So to try and answer your question from the Gonstead perspective, it really is about spending the time to find out where the major problem is. And we've got a long analysis that helps us get there. And then as accurately as possible, making the correction, and then giving the body its time and its respect to be able to see if it has actually made that change. So, not over adjusting the body, being very respectful to your sympathetic and your parasympathetic parts of the nervous system. And really just, not trying to fix everything at once. We just, if you can find the cause, correct the cause, and let the body do what it's meant to be able to do.
Okay. So a couple of questions that come up for me there would be, are there common things that contribute to that inference? So from I think you said subluxation sort of perspective, are there common things that can contribute to this sort of dysregulation in communication, if I call it that, from sort of brain to cell or tissue, that we can be mindful of? Are there things that we can do from a lifestyle perspective, or that we should just be mindful of to help with that?
Absolutely. So I think, subluxations, they tend to be caused by an accumulation of macro and micro traumas to the spine and to the body. So our macro traumas are things that make sense to all of us, right? If I fall down the stairs, if I get tackled hard in rugby, it makes sense that might physically jolt things around. I think what you're looking for is mainly your micro minor traumas that are happening constantly. Living in a gravity environment with poor posture, sitting too much exercise, too little exercise, incorrect exercise, driving a desk for a living, whatever it might be. These things have a physical effect on our spines all the time. And that's the physical stresses to the body, but we also have, mental, emotional stresses that are constantly causing our body to have to function and change from a neurological point of view, right? If we're constantly in a stressful fight or flight environment, our muscles are going to tense up. We're going to start to sit differently. We have our toxic stresses to the body. Patients often ask me, how a toxin can have a physical effect on your body. You go and drink too much beer tonight and tell me how your head feels. We have these stresses to our body all the time, and our body's own inborn intelligence has the ability to adapt to those, which is why we don't constantly have this dysfunction. But when the stress is more than our body is able to actually adapt to, that's when a subluxation may occur, and when we may start to see our symptoms and pain or whatever it might be.
Okay, so it is, I guess the most often one, as you say, is that accumulative wear and tear ultimately.
Yeah, I mean, by far what we see these days, the biggest trauma is a desk, rather than people plowing the fields and throwing their backs out in that kind of a way.
Right. Interesting. Okay, so with that in mind, you mentioned sort of a comprehensive or long sort of evaluation or assessment of that. So what does that sort of actually look like?
Well, we start off with a history, obviously understanding from the patient, so much of what's going on, you can actually get from the person, and what seems to aggravate things, what's happened in their lives. And then we start off with looking at the spine. All right. So we never work through clothes. We'll always have someone in a gown or someone with their shirts off, so we can physically see what the spine looks like. We statically feel the spine, see where there is areas of tension or inflammation or heat. We see how the spine moves. We feel how each individual vertebra moves. And then we've got an instrument called the nervoscope, which picks up very subtle temperature differences on either side of the spine. right? So we're looking at subtle changes in temperature, which might be from inflammation. They may be from dilation, constriction of your blood vessels, which is very indicative of nerve irritation or the autonomic nervous system. And the chiropractors have been looking at temperature changes from its inception as possible areas of nerve interference. And then when necessary, we use full spine x-rays, right? So we can actually see when we have found nerve irritation, what that looks like and what that biomechanical dysfunction might look like in the actual area, but also how the spine has compensated for that as it moves up. So we can therefore actually form a plan to think, right, this is where it looks like it really is coming from. And this is where we would expect possible areas to change as we go up, right? So if I've got an irritation in my left side of my pelvis and my whole right side of my shoulder has been compensating for that for the last 10 years so I can still work and do my job. Well, as we start correcting things down in the pelvis, we might start noticing some muscle tension or some pain or symptoms further up, for example. And that allows us to not run around and kind of chase each symptom and each thing that happens in the spine, but allow the body to go through that process and think, all right, well, we know where we started with, we know what we're working towards. And in the same breath, if we aren't getting the changes that we need, what are we missing, right? Where can we go back and think, what else may have caused that initially, and go from there?
Okay, so it sounds like quite a no, that's great. And I think it's fascinating that you're using heat as kind of an objective analysis of what's going on in that body.
Yeah, I mean, as I said, one of the things that drove me towards the Gonstead system is we can't walk around with 5 or 6 of these subluxations all the time, and it's about being a specific. Now, many things can contribute to heat, right? So, I mean, if I'm sitting next to a draft, if I'm getting a pimple, if I only ever do gym on my right side, but you do get a very different change of the needle on the scope when there is no pressure there and when there's very specific heat changes. And it is only one tool of what we use. But what I do love about it is that someone can come in, and if I'm not getting that reading there, and I'm not getting as much of a fixation in that bone, I'm not going to touch them that day. So I think the biggest thing for me from a Gonstead perspective is it's not always what we do differently, but it's what we choose not to do, right? What we decide to leave alone and think, you know what, your pain may not have changed or your symptom may not have changed at the moment, but let's give it a few more days because there's something happening around that area.
That's a really interesting point. So it's guiding sort of intervention ultimately on a day-to-day basis as well.
Yeah, absolutely.
All right. Yeah.
Yeah.
And where you're seeing that sort of potential nerve irritation things, would I be right in assuming that that's often not going to be the site of pain? So this idea that often pain is not sort of where the actual issue is, kind of thing.
Absolutely. Yeah. One of my lecturers at university used to always say, if you step on a cat's tail, does the tail scream? which I love because it's the perfect analogy. And areas that are compensating for the other areas, if an area is not moving properly, the body is amazing and it's intelligent, and it'll start to compensate so you can still do your daily activities. And those compensatory areas are now working harder, right? Which means your muscles are having to work harder. They can become slightly unstable. You're getting more blood flow to that area. And if that starts to get niggly, that's going to hurt a lot more than something that's just stuck and not moving correctly. So I'd say more often than not, the very painful areas are areas that have just been now overloaded from compensating for the actual problem for that long.
Yeah.
Especially in your chronic cases, which fortunately or unfortunately, most of the people who we see as chiropractors are people who have already seen everyone else, right? It often happens that way. And in a way, it's great because you think, cool, I'm your last resort. Let's see what we can do.
Yeah.
But yeah, I say good thing or bad thing. It's most of the people who come in to see us, it's either been something that's happened that day really acutely, or it's something that's been going on for 10, 20 years.
Yeah, I agree. I quite like seeing the clients when they've done and tried everything else, because it in some ways feels quite liberating.
Absolutely.
You kind of got to go and think outside the box a bit.
Yeah, and it also thinks, definition of insanity is doing the same thing over and over again, expecting a different result, right? So
right.
You almost, especially as you say, sometimes the pain isn't where the problem is. So it helps people get their mind around that too, that you think, well, I've got this terrible pain in my calf. What on earth are you doing looking at my back? Well, even the top doctors in the world looking at your calf, we're going to assume that the calf and the Achilles and those muscles are actually kind of okay. Let's see if there's something that's made them now overwork or fatigue faster or whatever it might be. So I kind of get some of that educational work out of the way, I suppose.
Yeah, exactly. Okay, and then I'm really curious around if there's anything we can sort of chat around and explore from, how do I want to put this? Almost like a non-biomechanical perspective. So maybe, for example, do you work with clients whereby they experience improvement in irritable bowel type symptoms by the stuff that you do? And what's the connection between the health of the spine and almost systemic health?
Yeah. I'll probably need to start off with this by saying, chiropractic doesn't treat any of these things.
Sure.
As much as chiropractic doesn't treat back pain. Chiropractic cures back pain as well as it cures irritable bowel. Right? It doesn't do either. As I mentioned, chiropractic is purely about making sure your brain and your body have adequate communication. So the brain can understand what's happening within the body and make the correct changes, and the body can understand what the brain's asking it to do. Right. So looking for connections between overall or systemic health and the spine kind of just takes us back to the anatomy, right? When a nerve, to simplify it as much as we can, when a nerve comes out the spine, it comes out as one single nerve, and then it starts to branch off. So to simplify, your branches that go backwards will go to your muscles and your skin, and that's how you can move and how you can feel. And the nerves that go forward from there will go to our body's organs, right? So if the problem lies when the nerve is actually still coming out of the spine as one nerve, it makes sense that if you're getting pain down your leg, if the nerves that went forward from there go to your gut or your bladder or your reproductive organs, there's a good chance we're getting the same amount of dysfunction to those tissue cells, if that makes sense.
Yeah.
So most of the people who see us, if we have these systemic things, have come in with a pain or musculoskeletal complaint. And that's why I said that the history becomes so important, because, in seeing that lady who's got terrible sciatic pain, and then you start to realize, well, they've never been able to carry a pregnancy past the first trimester, or they had, blood or chronic cystitis, or these types of things might constantly be popping up. And you think, okay, well, look, we can't say that is going to fix it, because that might not be the cause. There are many different reasons for miscarriages or cystitis, etc. But if that is being caused by the nerve pressure, look, there might be a good chance that this changes. Similarly, as I mentioned, we do work very closely with the autonomic nervous system as well. So as a Gonstead chiropractor, we're always looking to see, well, how is this person functioning, right? Are they very much stuck in a sympathetic or fight or flight response? Are they struggling to fall asleep? Are they constantly waking up during the night? Are their muscles hypertonic, tense all the time when they're meant to be at a state of ease? Or is the body doing the opposite? It's struggling to actually kind of get a kick up the bum and actually, start working when it should. This doesn't tell us where to adjust, but again, if we find the problem or two different problems, it often tells us where to start.
Right.
All right. And how to best respect that body and say, okay, like, you really are, your body's sitting all the time like you've got a gun to your head. Let's see if we can take that pressure off and allow it to realize it actually can go into more of a rest and digest, relaxed existence.
Yeah, no, definitely. And it just makes intuitive sense, I think, this idea of you're improving communication, energy flow within the body, and therefore you're potentially, clearing the highways, as it were, and allowing that sort of information, energy to allow for innate healing, ultimately, put vaguely.
Absolutely. I mean, when people finally get it, right? So when I'll have a patient come in and you'll see their eyes change and the penny really drops about what chiropractic is. The most common thing they say to me is they don't understand it initially because it sounds too simple. We were taught and we were trained to understand that health is this really, really very difficult to understand thing that we can only learn from someone who's got a million letters after their names and a stethoscope and a white coat. And we as an individual shouldn't be able to necessarily understand that. We need to go to someone for that. But as you said, it makes perfect intuitive health that, hey, we weren't born to have these problems. We weren't born needing these external interventions, right? Absolutely, they're very important when there is a state of crisis within the body. But just look at how well kids and babies heal. I mean, we were born into this world with this innate ability to function and to heal. The problems happen later on in life.
Yeah. Yeah, that sort of accumulative wear and tear, which is made, I guess, worse by the modern ways of living, like you say, with the desks, etc.
Yeah, and a lot of the problems that happen kind of above the neck as well.
Right. Yeah.
A lot of the things that happen and the way we treat our bodies mentally as well, I think has a huge impact on that.
Yeah. Yeah, that whole sort of mind body area really does kind of fascinate me, as it does for a lot of our listeners, I think. I was speaking to David Behrens last week on the podcast, who he actually spent 27 years as a monk in India.
Right.
And he's come to the UK a few years ago and now kind of supports clients with mental health issues, anxiety, depression, etc. And I asked him around some of the lessons he had learnt during his time, and one of them was sort of connection.
Right.
Another one I thought was really interesting was discipline. And obviously I think sometimes we can have a negative view on what we mean by discipline. You know, we think maybe of our headmaster at school and things like this, but his idea was essentially not getting distracted by things that weren't serving you or aren't serving you, which I thought was a really nice kind of way to frame it. And it's a little bit, I guess, like that what I think about when you discuss sort of the evaluation, the assessment, thinking of assessing sort of the heat that is being emitted and things like this, is it's providing a degree of discipline. It's giving you an information, a sign of, okay, where is it today that I need to be paying attention to?
Yeah, absolutely. Yeah, it allows you to, the person, I'm not deciding what that person needs for themselves. It happens, you can, someone be telling you something, you're looking at this person, you think, oh, I've seen this a million times before. And then you examine them and you're thinking, never would have thought the problem's there. That's what I love about it. That's where you choose, right? Is this the Glenn show, or is it something that has actually worked for many years before that? And go and start with that. Start with it, right? And that's why I love this system, because it's tried, it's tested, it's grounded in great principles, and it makes sense. And what I like about it is I can sit in front of any one of my patients with their exam, with their x-rays, with whether it's the first day they've seen me, whether they've seen me for a few months, and be like, well, this is what I'm looking at. This is what I believe is going on, and this is our trajectory of where I think we're going to go, without any guesswork. And I don't know how well you're going to heal. People heal differently, but this is why we're doing it, and this is what I'm hoping to achieve by that.
Yeah, no, that's brilliant. Do you going on to a slightly different sort of topic, but do you see any kind of almost clinical trends, for want of a better term, between, I guess, almost personality or personality characteristics and the human body? Again, I guess tapping into the mind-body connection. I was listening to a podcast on fascia yesterday, and they were talking about sometimes both the host and the guest were discussing really that sometimes you can make accurate assumptions, shall we say, based on almost how someone is holding themselves. You've mentioned stress and tension maybe in the upper traps and things like this. Is that something that you kind of see over your years of experience?
Yes and no. So, I mean, when I've only just moved back to South Africa. Previously, I was practicing on Harley Street in London. So around that area, you're getting a lot of very stressed people in, suits and ties. And initially, absolutely, you're seeing a lot of people who are coming in very stressed, kind of looking at their watch all the time, needing to get going because everything is so fast paced. And the assumption will come, well, this person's in a huge fight or flight stressful environment. And they might often present like that at first. But I think because so many of these issues have come from many years before, it's almost like layers. So yes, sometimes you'll sit there and again, you'll think, oh, I'm expecting the irritation to be here from the way they're carrying themselves, from their symptoms, but it's somewhere else. Or sometimes you do see it there, but after the first adjustment, they come back, and now you start seeing the real underlying things that have come from years before that. So again, very often those compensatory things that the way they've now carried themselves over the years what you're seeing at first, but the underlying issues come from before.
Yeah,
So
no,
but
that's
aside from that, not too many trends. No.
sure. And what about kind of the emotional side of things? So I've certainly spoken to a few colleagues in osteopathy and chiropractors and physios, and they all sort of discuss that, not necessarily on a regular basis, but they have experienced sort of clients who experience kind of a real emotional release when they're going through some form of body work. Is that something you see or know much about?
I certainly see it.
Okay.
I mean, the amount of people that straight after an adjustment have just burst into tears.
Yeah.
Men, women, older, younger, not because of pain, and most of them can't even describe why until the next time they come in. They very often say, you know what, that day suddenly this came into my head, or I felt myself letting go of this. And
Wow.
it happens far more than I would have ever thought, or certainly than I would have expected. In both ways, you know, can I explain why? Not beyond the brain and the body are communicating better, and you're actually allowing yourself to release something that you've actually built barriers on top for so many years, trying to physically hide, I suppose. And for some people, that takes a lot longer. You know, the developer of chiropractic said, if we had more chiropractors in prisons, we would have no need for them. I think if there's a great degree of self-awareness, I suppose, that comes from, in my eyes, in my opinion, from being adjusted. For me, one of my favorite parts is I'm more in tune with myself when I'm adjusted, and I'm absolutely discoordinated when I'm not. And I can feel it. That's for me, well, I need to go and I need to get checked.
It's really, yeah, I completely agree. And I think it's fascinating that happens, both that you can have such an emotional release, and it brings up work, I guess, by the likes of Peter Levine and Candice Pert. I listened recently to a sort of a CD series of Candice Pert, and it was just called "Your Body is Your Unconscious Mind." This idea that, you know, you are storing your emotions somewhere in the body. So it makes sense, as you say, that if you are now aligned and you are essentially, I guess, allowing some of these emotions, as you say, to become available to the brain or to consciousness maybe, and therefore as a result you're expressing them. It's fascinating, and I agree with what you said there around the alignment, and I don't know how to describe it, but the way that sort of, I guess, I envision it with inside my head is this idea that alignment and structure facilitates healthy energy flow, and ultimately we are energy. So it makes sense that if we are aligned and therefore energetically communicating at a cellular level better, that our awareness improves as well.
Absolutely. Yeah. I mean, the biggest thing about an adjustment isn't even to really always get things aligned. It's to get normal motion into that joint. Obviously, the structure determines function, and they do go hand in hand. But as you say, it's all about movements, and movement is energy, and we are energy. So
yeah. And then, I mean, what's coming up for me is the role that this can play potentially within immune dysregulation, so kind of autoimmunity potentially, neurodegenerative type condition. Ultimately, anything, there is potential for this to be part of our overall program in improving health and function.
Yeah, I mean, if your brain's not hearing the right messages from your body, or vice versa, if your body's looking at something which has no harmful effects to the body as something that is dangerous or something that is foreign, well, your body's just doing its job. Your body's fighting something that it perceives as foreign. The way to try and change that is to allow your brain to understand what it actually is, or vice versa, to allow your body to understand what your brain is trying to tell it. You know, I had a very bad seafood and iodine allergy growing up. And when I moved to the States, a friend of mine there did neuro-emotional technique, which is a chiropractic technique that I don't do. But it's very much based on the way your body reacts to different emotions that it's held within your body. If there's any neuroemotional technique chiropractors listening, if I'm going to go off of this, please don't kill me. Um, but when he adjusted me and he took me through the protocol, if I'm honest, and he knows this, I thought it was the biggest load of hoo-ha I had ever heard in my life. So there was certainly no placebo there at all. But absolutely cleared everything for me. At the time, I'd been in the emergency room 3 times for eating fish. I'd been there once after knee surgery because they'd put betadine on my leg because I didn't know there was iodine that I was allergic to. And that all completely cleared up through chiropractic. And again, I don't do that system, and an ET chiropractor would be able to absolutely talk you through that. But there's no doubt that if we just get rid of the area that's causing that miscommunication, and allow your body to just do what it's been born to be able to do, and it is doing billions of times per second, we will see global changes all over the place, but particularly in those types of, as you say, autoimmune type areas where the body is just not it's just not reacting as quote unquote it should, right? Otherwise as the norm would be.
Yeah. Well, it's again, it's like, I guess, some of Dr. Joe Dispenza's work and the mapping of the energy fields that they're doing during some of his meditations and things. And again, it just comes back to, I guess, similar principles and philosophy around sort of the energetic and the communication part of this, which is really the foundation of it. And correct me if I'm wrong, I can only assume that if we are structurally in better alignment, the nervous system is going to be in more of a potentially parasympathetic state, or certainly more balanced, like a homeostatic state. And if we think about the role that the nervous system plays in our perception of safety, and safety being really one of the foundational elements of a healthy mind and body, then there's probably a connection there as well.
Yeah, absolutely. I think the word you used there is homeostasis for sure. So if everything's in alignment, are we naturally in parasympathetic? Don't know. I suppose that depends on our environment, what it's in. And sympathetic doesn't necessarily mean over the top, gun to my head, what's happening right now, but we need to ebb and flow through those, I suppose, depending on our environment. And that's the big thing. If your body is able to adequately adapt to both your internal and your external environment, we're going to be able to function and react the way that we should. So, and that's where homeostasis comes in, that your body's constantly regulating everything in a state of ease when it should be in a state of ease. And it's going to go up and down from there depending on what's required.
Yeah. And what I find really interesting about that principle is, I think it was a paper on the thyroid that I was actually reading, but they were talking about if there is either a stress that's either chronic enough or acute enough, we recalibrate that homeostatic set point, and then the body actually will defend that as its new homeostatic set point. So it almost gets to a point where we have recalibrated. And I think, again, that's where any health intervention, whether it is sort of a chiropractic adjustment, whether it's diet, supplement, whatever it may be, it's all about trying to return to homeostasis. And as you say, kind of ensure that allostatic principle of being able to ebb and flow accordingly is working effectively.
Yeah, kind of letting your body choose its set point for where it feels you're at, rather than what a textbook thinks it might be. You mentioned thyroid. The same is absolutely for blood pressure, right? We hear that all the time, that your set point goes up, and the more and more we try and determine what someone's set point should be, the more the body's going to raise it. If you're living in a very stressful environment, then 120/80 might not cut it for you. Maybe try changing your environment before changing the set point. Yeah, absolutely. I completely agree with that.
Brilliant. All right. Is there anything else that maybe we haven't sort of touched on yet that you think would be really helpful for our listeners to know about you and your work and your style of work? Big question.
Yeah. The honest answer is probably no, because I'm always very, very grounded in what chiropractic is. Even coming onto chat to you today, if I'm perfectly honest, I thought, how am I going to speak for all this time on chiropractic when, Glenn, what's chiropractic? Well, it's good communication between the brain and the body, so your innate intelligence is able to flow and coordinate and function the body as best that it can. Right. That's short. That's not a whole podcast. So any further from me? No, I can't really think of anything else, Alex.
Okay. So one question that I guess I'm a bit curious of, and again, it will probably give our listeners a bit more insight into your kind of clinical practice, I guess. And I think I might know the answer, but so I don't just make assumptions. What are the type of clients that, come to see you? So if someone was like, oh my God, Glenn sounds awesome, I'm moving to South Africa so I can see him, what would be an appropriate person to do that?
Well, the honest answer is anyone with a spine.
Right. Okay.
The youngest person I've ever adjusted was about 8 hours old.
Wow.
And oldest I've adjusted was 98. Now, the reason for me I say anyone with a spine is chiropractic is my first, my primary form of healthcare for myself.
Oh.
Okay. I personally think anyone should be checked by a chiropractor. Doesn't mean that everyone needs a chiropractic adjustment, right? But the same as you would get your teeth checked by a dentist. I've always had a very big pediatric practice. I enjoy seeing kids. I love seeing pregnant mums. The majority of my practice has probably been just mums and families, in the whole family and together. But yeah, you don't always wait until you've got a symptom to go and see a chiropractor. It's good to go and get checked, just see how your body is functioning. The nice part about that is if you do then have a symptom down the line, you actually have a nice good base.
Fine. Yeah.
How were you before that and what has changed? And obviously, even better, you stop that actual pain from happening down the line because you're catching something before it becomes a bigger issue.
I think that's a really key point though, which is to have that perception of a chiropractor as the hygienist. You don't go just because you're reacting to something, but actually it is a preventative measure and a bit of an MOT if you aren't someone who's currently symptomatic and would be more inclined, I guess, to go and see someone for an evaluation. And that's, I guess, the theme of complementary medicine ultimately, is this idea that it should be as preventative as possible.
Yeah, absolutely. And there is a mindset out there that thinks, once you go to a chiropractor, you always have to go. Absolutely not. I've never, locked my doors and made someone make the next appointment before they leave. But people tend to want to come back after a certain time. And I think the main reason for that is the same reason why parents start to bring their kids in to get checked before they've got symptoms. It's because once whatever you came in for has dissipated and is feeling better, the two things that are always reported back to me are people are sleeping better and they've got more energy during the day. They're functioning better on a baseline level. And people want that. And when they aren't getting that, they notice the difference. They notice a different level of health. And so absolutely, it's great. If everyone got checked now and again for subluxation to see if they need an adjustment, I think absolutely we'd be preventing a lot of bigger issues, potentially preventing a lot of bigger issues down the road. And how often people need to be checked obviously depends on the person's overall state of health, what they're doing on a daily basis. There are many different factors determine that. But yeah, I think the big thing is just getting checked and looking at chiropractic as a form of healthcare, because it's not a crisis care. It's not a treatment. It's not the more you see me, the better you get. I'm not going to keep giving you something to make it feel better. We're just going to make you the best you can be. So I think on that kind of a basis, it does make sense to get checked whenever you can.
Yeah, and I think a big lesson that I've learned over the years working with clients is health is so much easier when we are in health, basically. So, catching things early on is such an empowering and efficient way to go about it, because ultimately things are less complex. And the longer we leave it, the more complicated and complex that sort of pathophysiology is often. And then it becomes essentially a harder job to get back to that initial healthy homeostatic set point.
Yeah, and I think, as you say, if you're in a state of health and things are going easier, it's almost harder to compartmentalize different aspects of poor health or disease, and it's certainly harder to do a double-blind controlled trial study of that little piece, right? It's very difficult to prove good parenting to a child that never went to prison, right? For example. Yeah, if we can be in a state of good health and avoid all those other little things, I think a lot of your friends and family start to call you lucky. I'm
Right.
very lucky that my daughter didn't have the normal childhood ear infections or the normal childhood cradle cap or fungal infections or colic, or just maybe she has a better functioning nervous system, and with everything else, with the nutrition and all the other health essentials around that. But rather than waiting for a state of poor health and me to then have to treat that.
Yeah, I think that's a pretty strong message to maybe finish with, Glenn. I think it's that concept is very powerful, and I think the challenge often is, or the challenge / excuse, and I've used it myself, so there's no judgment there, is, I guess, the financial element of this, the idea that I feel fine and therefore why should I go and have an assessment of any type, whether it's nutrition, etc. So it's that mindset, that mentality that I think we often have to just shift ultimately when we're thinking about it. We're forced to go for pretty much a car MOT, so we don't have that same impetus when it comes to the human body, unfortunately. But I think that message is so strong.
Yeah, absolutely. And I think it's if there's a lot of research out there on it, and I'd be lying if I told you the numbers, but if we look at how much people spend on healthcare over their lives, the majority of that healthcare by a long shot is spent obviously at the end of our lives.
Right.
And
Yeah.
I'll try and find the numbers and send them to you, but the amount of people who are spending, or the amount of people are spending on their healthcare who have been to chiropractors and who haven't, is significantly different. So if we look at that, as you say, that financial cost of things over time, I think it actually is more cost effective to prevent things than it is to try and fix something. It's far easier to kind of raise healthy kids than fix broken adults.
Yeah. No, absolutely. There was a paper I once read. What was it called? I think the title was something like Your Conception of Health. And it was basically all about asking the participants really what their perception or conception of health was. Was it fulfilling your roles as a dad, as an employee, as an employer? Was it essentially be able to have basic function and get out of bed and things, or was it more about being able to thrive and achieve your purpose and things in life? And obviously common sense tells us that our conception of health massively influences our approach to health. So again, it comes back to that relationship that we have with our body, with our narrative around health. And I think if we can nurture that from a younger age, then, as you say, we're having a huge impact in all sorts of different areas of life ultimately.
Yeah. Again, it's the questions you ask yourself about yourself and your health, you're going to get very, very different answers. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. No one knows that. No one knows what health is, but it's something that we thrive towards and we're willing to spend loads of money on. But how do you know you're healthier today than you were yesterday? It's certainly not because if I stub my toe on a wall and it's painful, it doesn't mean I'm unhealthy. That means I'm pretty healthy because I can actually feel it. Right? So, this conception of, if we're wanting to be healthy, let's first figure out what health is and strive towards that.
Yeah. And I think it's a really important question to ask our clients, because I've realized this over the years, which is sometimes we make an assumption that they have the same goals as us in regards to health and how they want to feel. And sometimes they're completely different. And I've actually found that I get a sense of relief sometimes when I realize, and I've actually inquired around, how would you define success in our relationship? And it's not often what I think success is going to be in the relationship.
I'm
So
so
that,
guilty of that.
yeah, that clarity is so helpful, just to, from our perspective as the practitioner, to be like, okay, this is what our kind of the goalposts look like, shall we say?
Absolutely. Yeah. As I say, I'm very, very guilty of that. Thinking I've got such an ideal perception of, you know, what health is. And well, you know, this is so obvious. Why wouldn't you want this? But everyone's different and going through their own kind of goals. So it's important to always meet the person absolutely where they're at and what their initial goals might be, and then look at what their long-term health and just lifestyle goals in general are.
Yeah. And hopefully those goalposts will, as you say, move back as you go through that journey ultimately, because I think sometimes, especially with kind of chronic clients, they actually just have lost hope and belief that they can get to maybe our definition of health or a optimal definition of health. But once you've nudged that state to a slightly healthier state, then it's like, okay, you know, we've had some success. Let's kind of see how far we can go with this.
Yeah, I think losing hope is a big part of that. You know, people have often been compartmentalized. You know, so as soon as they've now got a label of what they've got, well, then that's all they're going to research. They're going to look it up. And once I've got X disease, well, that's termed as lifetime illness. And there's almost that absolute disbelief of ever being able to get out of that. And it's our role, I suppose, as healthcare providers to help educate them that, but it's certainly not our role to make them believe it or try and kind of pull them out of it. It needs to be that person's willingness to do so, because all they've had through healthcare usually has been told, this is it, this is it, this is it. And it is important for them to be able to think, right, this is where my goalposts are, and this is where they actually potentially might be able to get to. But yeah, that loss of hope. I just think no doctor of any profession should ever remove hope from a person, because we've got no idea about that person's healing capacity. You know, call it spontaneous remission or call it the body finally being able to do what it was meant to be doing. Yeah, we've got no idea what's happened and what that person's health journey's been like and what their potential is. So we need to give them realistic hope, of course, but at the end of the day, we can't sit and play God or the decider as to, you've got no hope.
No, it's really well put. And actually, when you were saying some of that, what came to mind was just even like the weird concept of the diagnosis, you know, or pathology. It's like, okay, so this is the day you got diagnosed with this condition, but when do you think when was like that switch, and when did it flip? And if we can view it as more of a chronological kind of slow development, I think we can then start to appreciate that, okay, well, this is reversible. Not every single condition out there, but the majority of these non-communicable lifestyle-driven diseases, if we view it like that, it's so much easier to feel empowered and to think, okay, it's taken me 10 years to get here. It might not be a month for me to get back, but we can definitely chip away at these things and view it in the same way that we now view how this all started, rather than on this day I got this diagnosis.
Yeah, especially with things that have numbers like blood pressure, right? So
yeah,
you know, you're sitting at 120/80, I'm fine. The next day you go back 122/82 for a silly example. Well, now I have high blood pressure and I'm in this category. I mean, between yesterday and today, you could have had just eaten a salad. You could have had the healthiest day you've ever had in your life, and suddenly now you've got a so-called disease. And as you say, it's not the same for everything, and I'm by no means, you know, belittling the bigger things that do need chronic crisis care. But I think it's important for people to understand there is a difference between healthcare and crisis care, and both absolutely have their place. But I think when crisis care becomes healthcare, we have the chance of having a slightly sicker society.
Yeah, absolutely. Glenn, that's been brilliant. I think it's going to be really helpful for people just to understand a little bit more about, I guess, kind of the science ultimately of chiropractic and what it is that we're seeking to achieve when we come and see someone like yourself. So thank you very much for sparing some time to come and chat with me. It's been a lot of fun.
Great. Oh, thank you so much for the invite, Alex. I really enjoyed it.
Good.
Nice to spend some time with this lockdown we have at the moment. It's good getting to chat to people like you.
Yeah, absolutely. And I've promised Victoria, who obviously for the listeners is who introduced us to one another, that I would take a trip down at some point and visit her. So when I do, I'll definitely come and knock on your door.
Perfect. Yeah, I look forward to seeing you then. It'd be great.
Brilliant.
It'd be my pleasure.
All right. Thanks, Glenn.
Absolutely. Thanks very much, Alex.